A psychoactive drug is any substance that can influence your subjective experience and your behavior by acting on your nervous system. So that includes many things that are perfectly legal. Like one of my favorite drugs, for example, would be caffeine. Caffeine has a clear influence on your behavior and subjective experience. But not all drugs are taken the same way. Like there's different kinds of routes of administration that you can use to put drugs into your system. So one of the preferred routes for most people would be through ingestion, the oral route, just eating or drinking that drug. So that's how we intake drugs like alcohol, chocolate, coffee, things like that. The substances that we ingest are then absorbed through our digestive tracts. But this is one of the slowest routes. When you take in drugs through one of these routes, it generally takes a long time for it to be, effective. A much more direct, in fact, the most direct route would be injection. So using a needle to literally inject the drug directly into your bloodstream. So this bypasses all the traditional, routes and filters and things like that, and it gets the psychoactive drug into your system as quickly as possible. So you can inject that drug subcutaneously, so you can just inject it to be right under the skin, or you can inject it directly into your muscles, or you can actually inject it directly into one of your blood veins, like I mentioned. Inhalation is another method of drug absorption, breathing it in. That's how we traditionally take in drugs like nicotine, for example, or marijuana. Some drugs are traditionally administered through your mucous membranes, and you've got many different kinds of mucous membranes in your body. But those would include things like your nose, your mouth, your rectum, basically any porous, soft tissue. Drugs can pass through that tissue and into your body. So in order for any kind of drug to be effective, no matter how you put it into your system, in order for that drug to act on your brain, it has to pass through the blood-brain barrier. So in your brain you have a filtration system that prevents harmful substances from getting into your brain and causing damage. But that's not the only kind of protection that you have against bad substances. You also have enzymes in your liver, for example. Like a lot of drugs, including alcohol, are basically attacked by enzymes like your liver, and that's how we can remove those drugs from our system and prevent them from having really serious effects. And we also can excrete many drugs before they have any effectiveness through your sweat, through your breath, through your urine, breast milk even. So either we can filter the drugs out, break them down, or just get rid of them before they can have any effectiveness. So in order for a drug to be effective at all, it really has to overcome all these obstacles. Now, if you have become dependent on a drug, that just means you've used a drug long enough to develop an addiction. You have this compulsive need to use the drug just to remain comfortable. Like if you don't get that drug, you are going to be physically ill. Like you will feel sick, you will feel nauseous, you won't be able to just process daily life events anymore. What you'll experience is called withdrawal. So that's a physical illness, a discomfort following failure to take this drug you're dependent on. So of all the drugs out there, one of the drugs that has one of the most severe physical dependence issues would be alcohol, actually. So with alcohol, if you are addicted to alcohol, if you've developed a dependence on alcohol and you don't get it, you are not going to do well at all, to put it simply. people who stop cold turkey, like hardcore alcoholics who stop cold turkey, they can actually die from that because their body has become dependent on it. Their body needs that drug just to function. But you could also develop a psychological dependence. That's not really the same thing as what we think of as addiction. Psychological dependence is more so just you crave the drug because it's fun. Like you want to do it because it makes you happy. And if you don't get that drug, then you're not going to be happy. So it's not like you're going to be sick. It's not like you're going to die. You're just going to be very irritable if you don't get that drug. One of the drugs that has the most severe psychological dependence issues would be actually nicotine. If you know somebody who's addicted to smoking and they don't get their cigarette, they're probably not going to be a very friendly person. You probably won't want to hang out with that person until they've had their cigarette. The consequence of becoming dependent on a drug is that you will also become tolerant to that drug. So going along with this kind of physical dependence is just the fact that your body has changed. Your body now has just basically adapted to the presence of this drug, and the consequence is that the drug isn't really as effective as it used to be. Like maybe your liver is better at processing that drug and filtering it out, or maybe your body can just compensate in some other way. But the whole idea here is that you've developed tolerance. Your sensitivity to that drug has decreased because of this constant, exposure to it. And you can develop a cross tolerance, which just means, you're exposed to one kind of drug, and that develops a tolerance for other kinds that are related in, chemical ways, like alcohol and benzodiazepines. So the first kind of tolerance is what you would call metabolic tolerance. That's just because your body has adapted in such a way that it can get rid of that drug before it has a chance to be effective. So less drug is getting to the site of its action. It's just being excreted or broken down more efficiently. But then there's also a functional tolerance where it's kind of like your brain itself has changed. So your brain is just not as responsive to the drug anymore. So the same amount of drug might be getting to the brain, it's just the brain's receptor sites just don't seem to really be binding with that drug like they used to. Maybe there's less receptors, maybe the receptors have changed in some way. Whatever is the case, it's just that drug isn't as effective on the brain as it used to be. When it comes to the way people use drugs, there's different patterns of how people use drugs. First of all, experimental drug use is just kind of like a short-term use based on curiosity. Somebody just wants to see what the effects of some drug is, so they try it out. This is very common with younger individuals who haven't had many experiences in life. Then there's social recreational drug use, which is like an occasional use for relaxation or socialization. Like if you like to hang out on the weekends and have a few drinks with your friends, that's social recreational drug use. Then there's situational drug use, where you use some drug to cope with some specific situation, like maybe you need to stay awake really late into the night to study for a test. I'm sure you're familiar with drinking lots of coffee like that. And then the last two patterns are what I would definitely consider to be drug abuse. So intensive drug use is where we first start to see like clear elements of this addiction. So this is daily use with these kinds of dependence and withdrawal and tolerance effects. And then compulsive drug use would be intense use and extreme dependence. So it's kind of like with somebody who is a compulsive drug user, it's kind of like their entire life revolves around that drug. Like they're always either trying to find that drug or taking that drug or talking about the drug. It's just their life is the drug, basically. And there's two basic kinds of drugs that are out there. You have stimulants and depressants. So stimulants are substances that will increase activity in your body and nervous system, like cocaine and nicotine and amphetamines. And then there are depressants, which are substances that decrease activity in your body and nervous system, like alcohol, benzodiazepines, that kind of stuff. But I want to talk to you about a few specific stimulants first. Amphetamines, oftentimes we just call them by their street name speed. These are synthetic stimulants that excite your nervous system, so like dexedrine and methamphetamine. Amphetamines are actually very useful when it comes to treating certain disorders. Like there are certain amphetamines we call study drugs because they help to treat students who have attention deficit hyperactivity disorder, ADHD. It might seem a little counterintuitive that you would want to give a hyperactive student a stimulating drug, but it really definitely seems to work. So giving a child with ADHD Adderall or Ritalin actually kind of counterintuitively helps them to calm down and focus at school. The basic reason why this works seems to be that the student just needs stimulation. So instead of letting them try to get that stimulation from the environment, you can basically just give them that stimulation in a pill form. Unfortunately, amphetamines are easily abused. Like a large dose can cause some pretty serious consequences like nausea, vomiting, extremely high blood pressure, fatal heart attacks, and disabling strokes. You can even potentially experience psychosis, so that's a loss of contact with reality due to overdose of amphetamines. You'll also probably have paranoid delusions. And methamphetamine in particular, but amphetamines in general, can have some pretty damaging effects on the physical brain. So long-term use of methamphetamines can physically damage and destroy parts of the brain. Another stimulant is cocaine, which is derived from the leaves of a coca plant. And if you didn't know this, the reason why we call it Coca-Cola is because it originally had cocaine in it. From 1886 to 1906, Coca-Cola had cocaine. and it not only had cocaine, but it also had caffeine, so it kind of makes you wonder exactly how stimulating was the original Coca-Cola. The reason why cocaine has become illegal since then is because it's been clearly demonstrated to be a very addictive drug. So even though the withdrawal effects aren't so severe, like that psychological dependence, that craving that you get when you're like psychologically addicted to a drug is pretty severe for cocaine. So cocaine has some pretty strong like psychological dependence issues. Now, there's many different kinds of cocaine, but crack cocaine is one of the more well-known ones. It's a very potent, cheap, and smokable form of cocaine. So normally with cocaine, it's a powder that you absorb through your mucous membranes, like in your nose, for example. With crack cocaine, you can actually smoke it. And this is definitely the most addictive form of cocaine. So just taking a small amount of crack can quickly get you addicted. Now, pure crack cocaine is simply cocaine mixed with baking soda. That's all it really is. And unfortunately, though, since we don't really have any, standards for cocaine production, there's no government oversight or anything like that, people who sell crack cocaine will oftentimes put other stuff in there too that looks similar to baking soda and cocaine, like other kinds of white powders. Like you might actually see people put things like flour or maybe even like drain cleaner and things like that in the formula for cocaine to increase the size, like to make it look like there's more crack there, but in reality it's these other substances that potentially could be very harmful. So cocaine and crack is a very addictive drug. It has the really strong psychological dependence effects. And when it comes to how it affects the brain, long-term use can have some pretty dramatic, like physical damaging effects to the brain. Another stimulant would be MDMA, or ecstasy. This is chemically very similar to amphetamines. It's created by just making a small change to the chemical structure of an amphetamine. And in many ways, it's kind of seen as like amphetamine light. It's a slightly weaker form of amphetamines. in pretty much every respect, ecstasy is just kind of, the weaker form. So it has less addictive issues, it has a less of a stimulating effect, it has less, long-term damage effects, and so on. So just in general, ecstasy is considered less serious of, a stimulant. But you can overdose on ecstasy. Some of the more common problems people experience when they take too much ecstasy is like fatal heat exhaustion, because they're so stimulated, they're so busy, they're so active, they're so moving around that their body basically just gives out after a while. Also, if you ever see somebody like with a mouth guard, like in a club dancing, that's because excessive grinding of the teeth is also very, serious problem when it comes to ecstasy. That's, why they traditionally carry around those pacifier-looking things. But as I said, the long-term damaging effects of ecstasy aren't really as serious as other stimulants. Nicotine, another stimulant, is found in tobacco plants. And a single large dose of nicotine can cause stomach pains, vomiting, diarrhea, confusion, tremors. I mentioned earlier that it is one of the most psychologically addictive drugs out there. About 70% of people who try nicotine become addicted, so it's a very serious concern. Also, just because you don't personally smoke it, that doesn't mean that you're going to be okay. Secondhand smoke can be a serious health concern. Like, it always really bothers me when I'm out walking with my children and somebody's smoking right next to us. It's like, dude, I got kids right here. Could you just go away or kill yourself in some other place? And that I'm not really exaggerating, because long-term tobacco use is clearly linked to lung cancer. So if you are a smoker and you start experiencing what's called smoker syndrome, you have chest pain, labored breathing, wheezing, coughing, and just a higher rate of respiratory illness, that's a warning sign. You should stop immediately. You should try to get help, because, like I said, it's such an addictive drug. You most likely will not be able to quit by yourself. But you need to quit, because that's signs of serious damage having already been done. So smokers, long-term smokers in general, are just more susceptible to various kind of lethal lung disorders like bronchitis and pneumonia, lung cancer. One of my favorite stimulants would be caffeine. It's definitely a very, very popular stimulant. It's one of the most frequently used psychotic drugs, or it's not psychotic, psychoactive drugs in North America, if not the entire world. You can find caffeine in colas and chocolate and coffee. Just like other stimulants, though, if you overdose, you can overdose on caffeine, and if you do, you're basically going to be, really nauseous. You might have excessive sweating, you might have a lot of body tremors, and so on. But obviously, caffeine can be very useful, especially for college students who are trying to study for the, the test that's coming up tomorrow or whatever. But you can be addicted to caffeine. Caffeine is an addictive drug, just like the other ones I've mentioned. So caffeineism is when you develop this kind of physiological dependence on the drug. Like, I am addicted to caffeine. If I don't get my coffee every day, I'm going to get headaches, I'm going to be irritable, I'm going to be sleepy. So my body has developed a dependence on caffeine, and the consequence is that I'm also very tolerant to it. Like, I need large amounts of caffeine to get that stimulating effect. If I just have a regular amount, then it'll simply, put me back into a normal state. But I need extra to actually get that boost. My, children, for example, though, they don't have any of those dependence issues. So if they were to drink, like Coca-Cola, for example, they'd be pinging off the walls. Like, that caffeine is profoundly effective on them. But if you are pregnant, or if you're nursing a small child, you should avoid caffeine, because it can be transferred through, your body in that way. And to put it simply, caffeine is not good for babies. Now, when we go to the other end of the spectrum, when we talk about depressants, downers, There's many different kinds. Like there's tranquilizers, for example. These are drugs that are intended to lower anxiety and reduce tension. So things like Valium, Xanax, Halcyon, Librium, and Rohypnol. You may have heard of Rohypnol. If it doesn't sound familiar, you might recognize it by its more common name, roofies. Rohypnol or roofies are traditionally used to lower inhibition and produce relaxation or intoxication or even unconsciousness and short-term amnesia. People, unfortunately, have used this to take advantage of women. So we could call it the date rape drug, because if somebody puts this in your drink, it will have these effects on you, and you won't know that you ever ingested any drug. Oftentimes, not until it's too late will you realize anything bad had happened. But the good news is if you're concerned about Rohypnol, it is a colorless and tasteless drug, so you'll never know if it's in your drink unless you buy this specific kind of like nail polish. So they sell a nail polish that will react in a chemical way to the presence of Rohypnol, so all you would have to do is just kind of dip your finger in your drink to test to see if there's any Rohypnol in there. So that could be a really, helpful thing if you do like to go to parties and hang out in these kinds of environments. But the most common, the most well-known depressant is, of course, alcohol, or to be more technical, ethyl alcohol. So ethyl alcohol can be produced from a wide range of different substances. Like you can make ethyl alcohol from grapes, like wine. You can make it from various kinds of grains, like barley. You could also make alcohol from other things that you wouldn't normally imagine, like potatoes, for example. Like some Russian vodkas come from potato. So you can make alcohol out of basically anything, honestly. But alcohol is definitely a depressant. Even though drinking a little bit of alcohol might seem to make a person more energetic, what's actually going on is that person's inhibitions, that person's better judgment are being depressed. And the consequence is that the person is, more likely to do things they wouldn't do otherwise. But alcohol, as I mentioned earlier in the video, has got one of the most severe physiological dependence issues. If you are a severe alcoholic and you don't get your alcohol, you're going to very quickly go through some severe withdrawal effects. You could die. Your body could basically just shut down. But it is very important to be aware of what's going on with your body if you're an alcoholic, because if you become pregnant or if you're carrying a baby and you ingest even sometimes small amounts of alcohol, that can have damaging effects on the child. So fetal alcohol syndrome is you can tell somebody has fetal alcohol syndrome because they have a low birth weight, smaller head, very specific kinds of facial kind of defects and other kinds of body malformations and permanent behavioral and mental handicaps. These are very common signs of a child born from a mother who drinks massive amounts of alcohol. Now, some students in the past have asked me, what if the guy's drunk? Well, if the guy's drunk when the child is conceived, I don't really believe that's going to have any influence. I might be wrong, but even if the guy's completely, wasted on alcohol and has sex with a woman and she gets pregnant from it, I don't really think that's going to affect the baby much. Of course, if the father is an alcoholic chronically, that will of course affect the baby in numerous developmental ways, but that's for another video. So alcohol, it does have the most severe physiological dependence issues, and that's kind of mirrored in how it changes your body and brain. It does make some pretty massive changes to what your brain's physical structure is like. Just to put it simply, your brain will die. Parts of your brain will die off. Your brain, if you do a structural scan on the alcoholic's brain, what you'll see is far less brain. Parts of the brain basically just shrink, shrivel, and die off. And those parts of the brain that die due to alcoholism, you can't really get those back. Even if you stop drinking, you're still going to be mentally disabled in that sense. I don't know if you know anybody who's an alcoholic. I do. And when she was an alcoholic for decades, and when she finally stopped, she was able to regain some of her, life back, but she was permanently mentally disabled. Like, I'm not saying she was incapable of doing anything. It's just, imagine like a 50-year-old with the intellect of a teenager. That's basically what she was like. And there was pretty much no chance of recovery from that point. I don't want to be too depressing, but the story has a sad ending. She did die shortly after becoming sober due to these long-term damaging effects of alcohol. So if you know somebody who's an alcoholic, don't just brush it off. Don't pretend it's not an issue. That person needs help. Alcohol is a very serious thing, and you have to seek treatment in a very serious way. Now, traditionally, like I said, you don't want to stop cold turkey. Traditionally, what you want to do is called a detoxification process, where oftentimes under the supervision of a doctor, you just kind of gradually wean yourself off of that drug. Now, after you've detoxified, traditionally what people would do is they join like self-help groups, like Alcoholics Anonymous, for example. And that can be, I used to think that was a helpful organization, but I recently read some research about how people who attend Alcoholics Anonymous, they actually have an incredibly poor success rate. So Alcoholics Anonymous, in my opinion, does not seem to be a very good, method of treatment for alcoholism. The good news is, there's actually a pill. Like, it might seem a little strange that you could take a pill for alcoholism, but yes, that's real. That's legitimate. There is actually a pill out there that helps people overcome an addiction to alcohol, and it has been demonstrated over and over again to be very effective. Now, you might be wondering, why haven't you heard of this before? If there's a pill that can help alcoholics, why aren't we giving it to everybody? Well, the basic answer I can give you is because people traditionally look at alcohol as a behavioral problem. They don't look at it as a medical problem. So you wouldn't want to give somebody with a behavioral problem a pill. You would want to give them therapy. And that's basically what Alcoholics Anonymous is. So all I'm saying is, when it comes to alcoholism, you should think of it in a more medical way. Like, this person has an illness, and we need to treat that illness with medicine, because we have a medicine that works. Other downers, other depressants would include things like opium. If you've ever heard of like morphine, for example, that's one kind of drug that can come from the opium, like poppy plant. So there's many kinds of opiates, like the heroin, for example. Now, the medical uses of these opiates would be to basically kill pain, painkillers, analgesics. And they do have a pretty high risk of addiction. So addicts who are addicted to various kinds of opiates, they will demonstrate a lot of these physical and psychological dependence issues. And the best way we can help them is through the same basic methods I've been describing. See a doctor and have these kinds of medical interventions. But of course, we have to bring up marijuana. Marijuana is another kind of depressant. You could just call it pot. It comes from the common hemp plant. Now, marijuana has been around basically forever. Like, if you look back at U.S. history, you'll see that even the earliest colonists were using marijuana for various different purposes. Like, traditionally, ropes were made from hemp. So marijuana has been around forever. It's definitely not a new thing. But when it comes to the psychoactive effects, it definitely is a depressant. And, the primary effect of marijuana is to lower your body and brain activity. Now, high doses are well known to impair things like your short-term memory and, any tasks that require more than one step. Like, if you tell somebody to do a complicated task who's really stoned, they'll probably forget what they're doing halfway through and start over again, or just wander off to do something else. You could also experience respiratory problems, like asthma, for example. A single large dose could trigger a heart attack in certain individuals who are at risk of heart attacks. But we have no evidence that marijuana can cause permanent damage to the brain, and there's also no evidence that marijuana is linked to any kind of mental disorder. In general, marijuana is not really considered a serious drug by modern scientists. So all the scientists who have looked at it in the last few decades have all come to the same conclusion. It's not a very addictive, if at all addictive, drug. It doesn't really have any permanent damaging health effects, and single large doses could potentially cause problems, but they're not nearly as serious of problems as the other drugs I've already talked about. So these negative effects of marijuana just don't really seem to be that severe, especially when compared to things like alcohol and nicotine. Now, besides recreational uses, marijuana also has some clear medical uses. Like, it can help to treat people with nausea problems. It can help to treat people who are having seizures. It can help asthmatics. It can even help people with glaucoma and reduce some forms of chronic pain. So marijuana definitely has some clear medicinal uses. Now, if I were to say that there's a third class of drugs, I would say that third class consists of hallucinogens. These are substances that don't really have stimulating or depressing effects. They just alter your sensory impressions. So now I'm talking about things like lysergic acid diethylamide, LSD, or mescaline, like peyote, psilocybin, mushrooms, PCP, like angel dust. So these drugs may have some stimulating or depressing effects, but their primary effect is definitely that of producing sensory distortion.